All right, well, thanks for coming. I want to, as mentioned, I would provide some updates, and then we'll go to different formats as we go on. But today I figured it would be good if I did another stand-up update for you. I want to start by thanking again the hospital, our medical people, and our internal people as we work together for the benefit of ensuring that Cleveland in general and Clevelanders in particular are safe. And we are closely monitoring what's going on in regards to the virus, and we know that there are no boundaries associated with this, and because of that, we are taking numerous precautions as we move forward. Now, the policy group oversees, as you know, we formed this, we had a proclamation declaring civil emergency, and we set up a committee that is meeting on a daily basis to talk about those things that are going on to keep us updated. This policy group oversees conditions during the civil emergency and makes recommendations on actions necessary to minimize the adverse impact of the civil emergency. In that case, this is the virus, and this includes the amendment of whether it's rules or procedures or other things that the authority that we have under this proclamation. Now, I have advised in the last press conference, we advised organizations and businesses and event planners to consider whether or not they will continue or cancel the event, and I'm happy to say that we've got a great response from that. I have a list. I won't go over the whole list, but I know that you are keeping track of it. But I do want to mention a few from the Playout Square, the Metro Parks, Great Lakes Science Center, Botanical Gardens, Rock and Roll Hall of Fame induction has been postponed. We have even some church services. The Word Church has canceled the weekend or three this weekend for church services. The MAC tournament, the Ag Center is closed down its operations for this weekend. We have the various museums, the orchestra, and we have the Wolstein Center is also doing. So there are many groups who are responsible for the gathering of people who are closing down their event or canceling events. And I want to thank them. I want to thank them for their cooperation. Now, just like other businesses and organizations, we're looking at our operation and the effect of all of these changes on our employees and the impact it has on them. And for example, we are reviewing our current HR policies around sick time, as well as essential versus non-essential employees and work at home policies, just to name a few things. And we're looking at our reoccurring boards of commission meetings and where we're having, as you know, we have city planning, board of appeals, all of this, and those meetings sometimes are quite crowded because of people who come there for business. And we're looking at how do we structure that in a way that will be convenient but safe for the people who will have to be there. We're looking at a way to better help residents during this time. So we're saying to the Cleveland water system and the Cleveland Public Power to temporarily cease shutoffs and restore disconnection. As you know, part of the way of preventing is the hand washing and having water and having heat and having all those just basic utilities are essential. So we are stopping cutoffs and we're doing restoring connections. Now we want people to protect themselves, and simply put, you need the access to water, as I just mentioned. We're also reviewing all of the city's buildings to raise our standards. We want to sanitize all public buildings, and then we want to maintain that level of cleanliness. So to that end, we are bringing on a company that will do the initial sanitizing, and then we're increasing, I think doubling the number of employees on a temporary basis to maintain that level of cleanliness. In addition, Camp Forbes and the Highland Golf Course banquet facilities will not be permitted for future events until further notice. We're placing a moratorium on AAU travel. This is basketball teams that for AAU that the City of Cleveland sponsors on travel until the end of April, and we have initiated a citywide ban on travel for all City of Cleveland employees until further notice. Now, equally important is our alignment with our other governmental entities, whether it's the county or the state. And as you know, the governor has ordered that prohibiting the gathering of 100 or more persons, and as recommended by the CDC, wherever there are gatherings, to keep a safe distance, which they recommend to be 6 feet. Now, there are, as you know, many unknowns about this virus, still unknown, but we continue to take numerous precautions across multiple departments internally and divisions to protect the safety and well-being of our employees and our citizens. I do want you to know that we continue to work with our hospitals. We talk to them on a daily basis, whether it's the doctors or the hospitals, to see what they are doing. I know that they are setting up protocols as we speak around potential testing and other things, and we will be meeting with them as this the number of cases increase and the demand on their capacity increases. We will be meeting with them to see how we can better coordinate between the public and them, public sector and them, to get the best outcome for the people who need the service. So if you have any questions, there are people here. If I can't answer it, they'll answer it for me, okay? Questions? Yes, ma'am.
Has anyone been affected by it, or any of your employees, or anyone sick? Or
Not that I know of. Not that I know of. If it would have been, they'd be quarantined and all that, but not that I know of. I'm not aware of it.
Are you concerned for your own health?
I'm concerned for your health.
Oh, thank you.
And I'm concerned for everybody's health in this room, which includes me. So I mean, it's a virus, and it spreads as a virus. So I'm concerned about the health of all the people.
The travel ban, is that?
Yes.
What is that's like out of the state?
No, it's travel. If you're working for the City of Cleveland, we start with you're prohibited from traveling. And then if there are mitigating circumstances that absolutely require you, then we'll deal with that on a one-on-one basis. But there's a travel ban for the City of Cleveland employees. Yes, sir.
With the kids off school the next
Right.
3 weeks, is there anything the city's doing to supplement meal programs that the kids depend on for food?
Right.
Breakfasts or lunches or?
Well, no, I know that there are people who are stepping up to and volunteering to provide resources for that, and we'll be in discussion with them. But I want to remind you that during the normal spring break, we never provided food, breakfast, or lunches, and that was taken care of through their families. But there are people who are stepping up and volunteering to provide us resources to do that. So we'll be in discussion with them.
Is there any discussion about the drive-through testing at the fairgrounds?
Right. Well, I know that the health department, the county, and the city health department is working together on that. And I know it's not fully implemented yet, but Merle, if you could talk to me.
Thank you. Thank you for the question. The two health departments are working with all the hospital systems to make sure that this is a coordinated approach and identifying which types of categories of individuals will be tested and all the protocols for that. So that should be forthcoming. We are expecting that there'll be much more information about that in the next probably 48 hours. My name is Meryl Gordon, the Director of the Health Department. Yes.
Real quick, is there any update on numbers, if there's, that's...
Well, all I know of,
They said they've seen a handful of cases. I mean, a handful could be,
a handful of additional cases.
yeah.
Well, we've heard the same thing. I'm not fully aware of that. That data would go from, let's say, if it happened in Cleveland, it would go to, if they lived in another county, then they would notify that county health department, is my understanding, which then refers it to the state. And I've heard the same thing, but I have not confirmed that.
This may not be something you can answer, but at the stores, there's people like emptying the shelves of all the toilet paper,
Right.
tissues and stuff. Is there any discussion about, I mean, I don't even know what you could do, but if it's a state of emergency, does government get involved at some point because people are like fist fighting over, a roll of paper towel?
Well, that I cannot say to you at this moment. As I said, we have this committee, and that's one of the topics they could look at to see what authority we have. I know, I think Mr. Yates, what is his title? Yost. Mr. Yost has issued some statements around gouging and processes in that regard.
Do you anticipate you'll hold a briefing tomorrow?
No, not on a daily basis. If something of emergency occurs, that, yes. This is more so that we can keep you engaged in it. What we will do, however, is release stuff on a daily basis. It will not be a press event, but we will be giving out information as we know it. Anybody else?
This may be too early also, but is there anything taking place, like, in terms of if there was widespread infection? Are there certain employees working out at certain locations to stay away from people, like, so that there is always someone, like, at the command center or ready to go?
Well, that's part of what this committee is looking at, and when we're looking at our HR policies, our essential employees, non-essential, who can work from home, who cannot work at home, they have to come in, those kind of things. And if there's an impact on essential employees, then what do we do to fill that gap? So those are the kinds of things that we're currently reviewing.
Do you have a timeline in place for everything that's been happening with the water system and making sure that people do have access to water regardless of?
Darnell?
Good afternoon. My name is Darnell Brown, Chief Operating Officer for the City of Cleveland. The announcement the mayor made is going into effect immediately, and so that the discontinuing of service has already been stopped. We'll be putting out a release that will give numbers both for the electric utility and the water utility for folks who currently are disconnected from the system to call and make arrangements to have that service restored, and we'll be following up to make sure that gets done in a timely manner.
Do you have enough First Energies doing anything like that?
No, you can call them, they'll tell you. Or they might. Yeah.
Local government should take charge and not wait for the federal government.
If I'm understanding, do you think we should be doing what we're doing?
I actually wonder what you think.
What's that?
Do you think local government
Uh-huh.
should lead the efforts and not wait for
Well, we're doing whatever we need to do at this time, and we're not waiting for anyone. We have, the governor has taken great leadership on this, Governor DeWine, and has done some things that has made it much easier for local governments to take action. And so between the city, the county, and in the state government, we're doing whatever we need to do. I'm not getting into the political debate of who should be doing what. Leadership comes from those who, wherever there's a responsibility, you take charge of that responsibility. And that could be just a patrolman out on the street, a doctor in an emergency room, or even you as media people taking responsibility for what you're responsible for to ensure people's safety in this regard. And that's what we're doing. And we've had calls from the Federal Health and Human Service people in regards to what they're planning to do and all of that. So yeah, we're working in coordination. There's no leadership of who should be in charge. It's about how do we protect the people.
What's your message to your people?
We're working. We're doing what we can do, and that we're planning ahead to see the governor has said that if you extrapolate what we currently know, that there are at least 100,000 people with the virus in the state of Ohio. So with that means that it's everywhere. We are doing those things necessary to minimize the severity and mitigate the impact of that. And we've had great cooperation with the private sector, with event people, and people are working together to try to ensure the safety of people. But it's not going to be easy. It's going to be an uphill battle, but we're here for that.
Do you have a message to your residents of what they should think, how they should behave, anything that you can advise them?
Well, I think that is part of, they should look out for themselves and their health. And there's clear guidelines on how they do that. And they should not be putting themselves into a situation where they could be contaminated. And if they are, and they do wind up with the virus, then we are working on the process to ensure not only do they have proper testing, but proper care as a result of that.
You may have answered this before, but
Yeah.
like the rec centers, since all the kids are going to be out of school.
Well, that's one of the things that we were considering. As I said, we've canceled the senior programs at our rec center simply because we know that they're the most vulnerable, and as you know, children wind up in close contact. They get colds, they catch the flu much quicker than anyone else, and they'll take it home, and they'll take it to the rec center or take it somewhere. So we've taken the initiative to cancel the senior programs, and we're reviewing as we go along whether it will be necessary to just close up the rec centers. Right now, what we will be doing through this contractor is sanitizing all of the public buildings, particularly the rec centers and those areas where you have a lot of activity, people sweating, locker rooms and things like that.
A question that might be more for the health department, but with kids being out of school, it seems like maybe a lot of parents will be turning to grandparents to babysit. Is that going to become an issue? Should people try to keep their kids away from their grandparents, that sort of thing?
Well, you know, that becomes a personal choice because it's not, what we give are the facts. And the facts are the most vulnerable people are elderly or those with underlying chronic illnesses. And so knowing that, then people have to make a choice as to whether or not they will expose that population, whether they're relatives or not. You know, so that becomes a personal choice. Our advice is that you do whatever's in the best interest of your family. So that's their choice. Anybody else? I thank you very much. Thank you.